Let's talk this through by speaking with a public health consultant, Dr. Nseabasi Ekanem. Thank you so much for joining us on TVC News this hour. Well, this is something that a lot of Nigerians, there was a report from a news agency saying that some vaccines had expired. But then what do you think is the significance of this exercise?
Well, thank you for having me. So the expired vaccines, like it has been reported, has been incinerated publicly by the National Primary Healthcare Development Agency in partnership with NAFDAC. And this is a very remarkable act because it will help to restore confidence in the hearts of many Nigerians who have begun to, entertain some of those misconceptions that a lot of vaccines that are available may have expired and may still be used, by the agency on Nigerians. Yes, we understand the reason why those vaccines expired. Most of them were donated to us. And after being donated, some of them were donated at close to expiry period, which of course is a lesson for us. But then this act of public incineration of the vaccine, the expired ones, goes to show that the agency, the government itself, is committed to the well-being of all Nigerians. And this should restore confidence in Nigeria. It should give them, Nigerians, the impetus to go out there and take the vaccine, knowing fully well that the government that is providing this vaccine has their well-being, at heart.
Well, this is not the first time this exercise is happening in Africa. For instance, African countries like Liberia, Mauritania, Guinea, DRC, Sierra Leone, and so on, have also destroyed some expired vaccine, COVID-19 vaccines. And some of these vaccines that have been donated to the African countries, they don't last more than 6 months. Do you try to find out why we receive vaccines with short lifespan?
Okay, yes. So the reason is quite evident. As you may know, there has been some level of nationalism with the distribution of vaccines across the world. We've seen the high-income countries taking up to 90% of the total global vaccine volume that has been produced. I mean, that is one of the issues that we are having, that we are battling currently, because this act of vaccine nationalism is against the SDG goal number 10, which says that we should reduce inequality within countries and among countries. Unfortunately, we've seen that play out in this vaccine rollout. And so most of African countries, or probably the low and middle income countries, have been depending cap in hand on the high income countries, particularly those countries where these vaccines are produced, to have access to the vaccine. And upon all of that, less than 10% of the global vaccine supply gets to Africa. And so it is common to see that most of the vaccine that we are receiving is those that are given out to us by other countries that don't need those vaccines again. And of course, they have those vaccines that have been on the shelf for over 6 months. And so whatever is left is what we have. I mean, this is a clarion call for all of us African countries to say, look, we need to invest in medical research. We need to produce our own vaccines so that we can be able to vaccinate our people when it is needed. So it's a challenge to us, and I believe that we've learned lessons from this.
Well, COVID-19 vaccination program commenced in Nigeria in March, and since then, just less than 9% of the target population has been vaccinated. Since then. But what are we saying about the fact that we need to vaccinate the largest population in Nigeria to ensure that people are vaccinated against this virus in the face of the Delta variant, and now we're talking about the Omicron variant? Do you see us being, this targeted population being achieved with a shortfall in the quantity of vaccines that we have in circulation in the country at the moment?
To be honest with you, as a consultant in public health, I will tell you, no, we are not achieving that. Our target was to achieve herd immunity, vaccinate over about up to 70% of our population by the end of 2022, and we cannot achieve that. So that is off the line. So what we are trying to achieve now is at least to be able to vaccinate a considerable number of persons between now and the end of 2022. And that would need a collaborative effort from the private sector, the public sector, and the social sector. We need to allow the private sector to bring in these vaccines. We need to allow the station sector to collaborate with organizations, with manufacturers, to see how these vaccines can be brought in. The public sector cannot do this alone. If we must achieve at least some remarkable success by the end of next year, then we need all the sectors, all the multi-sectoral approach with all the sector coming on board and bringing in these vaccines and educating Nigerians so that Nigerians can go out there and take the vaccine. Because it's one thing, my brother, it is one thing for us to bring in the vaccine. It's another thing for Nigerians to take the vaccine. So we need to invest more in public health education so that when we bring the vaccine, we can have Nigerians who will willingly go out there to take the vaccine. Maybe with that, we can achieve some considerable success.
Right.
But herd immunity, I don't think we can achieve that by the end of next year.
All right, let's begin to continue to hope that a lot of the relevant agencies will ensure that these vaccines are there in this country, and then looking towards to also providing our own local content in terms of vaccination. Public health consultant, Dr. Nseabasi Ekanem, thank you so much.
Thank you for